So after surgery, the patient experience depends on whether they've had their operation awake or whether they've had their operation under general anaesthetic. For my patients who have their surgery awake, they walk out of the theatre knowing what was done and what the plan is. Usually patients get a copy of their operation note and, if appropriate, a copy of my preferred rehab protocol, so they can take that to their physiotherapist. Depending on what operation they've had, I try to see them around the 2-week mark to trim or remove sutures and check on their progress. And then most patients will follow their physiotherapist through the rehabilitation program. I keep up with patients on a regular basis as needed, but I do try to keep follow-ups to a minimum, as there are extra costs to patients and their insurance policies if we have too many follow-up appointments. If patients have fractures, then quite often they may need x-rays at certain intervals after surgery to look at the progress of bone healing. But most patients who have elective surgery don't need any post-operative investigations. If a patient has a general anaesthetic, quite often on the day of surgery they may not remember much of what's happened to them or what was said to them, even detailed discussions that we have after surgery. So I tend to make sure that those patients come back to clinic at 2 weeks when we inspect their wounds and trim their sutures and have a detailed explanation with them of what we found and what we did and what the plan is for rehabilitation.